Hi, welcome to Evelyn's Desk. All right, get ready, y'all. Today I wanted to talk to you about what I wish patients knew before starting GLP medications. Once you start on a weight loss journey, you feel nervous, you feel anxious, there's a lot of questions, there's a lot of what ifs. Now, all of that is okay. These feelings are also exacerbated when you are talking about doing a GLP medication, and starting on them. Again, this is okay. These medications are there to help you, and those feelings are normal. We're humans. We feel things. But before you start on a GLP medication, it is worth knowing what the medication does and doesn't do. What it does do is that it does suppress the appetite. What it doesn't do is that it doesn't magically help you to lose weight. It does so in a backwards kind of, in a sideways kind of way, as a side effect of its true effects, which are to slow down the digestive system. Scientifically speaking, there's many other functions of GLP-1 within the body, and those are being currently studied. But for weight loss purposes, this medication helps to slow down your digestive system, and therefore you get fuller faster. And that's, in the simplest form, what it does. Again, what it doesn't do is magically help you, have the scale go down in weight, right? You do that by following, implementing habits, right, that help you to get those results. The medication just makes the implementation of these habits easier. The first one is going to be hydration, right? The first one of these habits, making sure you are staying hydrated throughout the whole day. The second one is going to be making sure that you are eating a high protein diet. And if you are not there, check out our guide. We have a GLP-1 success and maintenance guide that we created, and it walks you through that process. It's going to be in the link below. But getting back to the habits, high protein, work your way up to it. High fiber, work your way up to it. As it is, we here in the US typically don't eat enough fiber for the day. So you should be somewhere between, somewhere about 25 grams of fiber, for the whole day, if not more. But work your way up to it. Again, the GLP guide for success and maintenance is there to help you with that. So go grab that. But with that, with taking the GLP medication, you are implementing these habits to help you to lose weight, so that way you have the best result that you could. And then on the other side of that, before you start the medication, you're probably also thinking, will I have any side effects? We have the good side effect of it helping you lose weight, helping to regulate blood sugar. But then on the negative side, what are we looking at? We're going to be possibly looking at nausea, constipation, possibly diarrhea, but all these things can be mitigated if you follow the providers and or practitioners' recommendations. And that's where, again, it ties into the healthy habits, making sure you're staying hydrated, making sure you're having the high fiber, making sure you are moving, having the high protein. All these things together help to minimize the side effects. Now, not for everyone. So before you start these medications, you want to make sure that you are able to, how to contact your healthcare provider so that they can help you and guide you with your individual program. And that way you are continuing to use these medications safely. And then as you are using these medications, you have to also realize that losing weight is not, a steady decline. There's going to be bumps in the road, right? There is going to be some days where you lose a little bit, some days where you lose a lot. And it's what we're looking for, what the goal should be, is a trend down, not a steep decline, right? Because we want to, at the end of it, because you also have to think about the end result, right? You want to go in with a plan. You want to know what you want to make sure you understand and know what it is that you need to do to get to your weight loss goal, or, you know, do the body that you want to get into in a safe way. That's why you're visiting your healthcare provider, or coming, you know, and having us help you. But you want to make sure that it is safe, that it is appropriate for you. You want to make sure that you know what you are doing, but you also want to have an exit plan. You want to know, you have to have in mind, what are you going to do after? Like, okay, you did the thing, you lost the weight, you did the habits, you drank the water, you ate the protein, you had the fiber. Wonderful. What are we doing after? Well, that's where maintenance comes into play. You want to make sure that the habits that you had for weight loss, they can also carry you to maintenance, because weight loss is one thing, maintenance is another. But knowing how to get from there to here, that's where you will need help, and you want to make sure you have a plan for that, right? You want to make sure that you are able to transition safely, and whether that is with or without medication, that is going to depend on you as an individual and your healthcare provider, what you decide together to be the best plan for you. Again, we want to be focusing on safety. We want to make sure that we are doing it properly and that it is the right thing for you to do. And so at the end, the big focus is that, you know, just because you are going on these medications, it doesn't mean that all is lost of you or your failure. None of that. It is, and it is okay to be nervous. It is okay to be anxious, but that also means that if you have questions, you should ask them. If you have doubts, you should voice them, and speak to your healthcare provider. They should be able to answer these questions for you. And seek a second opinion when you don't feel comfortable. Here at Live Light Weight Loss, we have been helping people lose weight for 18 plus years, and with the GLP medications, it's just another tool in the toolbox that helps you to lose weight safely. If you want to grab the GLP Success Maintenance Guide, click on the link below. You'll get an email and be able to download that guide for free. If you need more help, stay tuned. Thank you.